So it's my pleasure today to introduce to you Dr. Mylene Huynh, who some of you know, she sees patients in our clinic. I use as half a day a month, but she also has clinic over at Walter Reed in the pain management clinic. She'll be speaking to us today on personal protective nutrition and lifestyle. So I will hand it over to Dr. Huynh. If you have questions as the presentation goes on, please put it in the chat box. I'll be monitoring that, and Dr. Huynh will have some time at the end to answer your questions. So I'll hand it over to Dr. Huynh.
Thank you, Dr. Gosha. Welcome, everybody. Good morning, good afternoon, wherever you are. Some of you are taking lunch, so feel free to eat lunch during this talk. I have no relevant relationships to disclose, and this presentation is my own opinion, does not represent opinion of USU, Air Force, Army, Navy, or Department of Defense. Here are my objectives for today. We're going to talk about the impact of nutrition and lifestyle on immune function, describe the role of personal protective nutrition and personal protective lifestyle in optimizing performance, readiness, and resilience, and share how we clinicians can improve PPN and PPL in addition to PPE and vaccine for COVID prevention. So we're gathering today, almost a year today, when the World Health Organization declared COVID as a pandemic. In March 11, 2020, on the day World Health Organization declared it, we had 118 cases with little over 4,000 deaths. And today, 117 million cases, 2.6 million deaths, and the United States has the highest fatality at over 500 million cases. So just to review the threat in terms of the context that I will present in PPN and PPL today, that this virus have these spike protein and enter our cell, and the reason we're seeing so many different complications and manifestation because we have ACE2 receptors in our lungs, intestine, kidney, blood vessel, and it activates the NLRP3 inflammasome pathway. Because most of us have not seen this virus before, we have very limited adaptive immunity. We require our innate immunity to respond. And this virus has a capability to disable our macrophage, our first line defense. And so we're seeing a variation in manifestation from asymptomatic to severe and death. The complications that we're seeing with COVID is very similar to what we in the military call the fog of war. It's due to inflammation because our body is fighting this virus and inflammation is produced in the consequence. Cytokine storm, oxidative stress, low perfusion, endothelial dysfunction, and microemboli. So one virus, very manifestation, many diseases. We have, the CDC estimate that up to 40% of the population may have the infection but have no symptoms. And those who have symptoms, 80% experience mild to moderate symptoms. What we are mostly concerned about is all 20% of the population who require hospitalization and have severe complication. And that's what we call a vulnerable population. We know a lot more about those who are hospitalized than those who are asymptomatic. I look at the literature and we've got very little, almost none, on those who actually have acquired the virus and have no symptoms. And that's a population that I'm, as a family practice and preventive medicine physician, I'm very interested in what made these people more resilient. I'll talk a little bit about that. And as a refresher, remember the Triad. Triad tells us that diseases don't occur randomly. There's an interplay between host, which is us in the case of this pandemic, the agent, SARS-CoV-2, and then the environment. So changes in any of these factors can determine the disease manifestation and outcome. Purpose of this presentation, I will focus on the host factor. So host factor, why are we seeing so many hospitalization and deaths in the United States? Well, if chronic diseases or obesity are the risk factors for COVID complications, we have a lot of those. 6 in 10 adults in America have a chronic disease, and 4 in 10 have 2 or more. And this is according to the CDC. And there was an article published in the Emergency Infectious Disease that showed 45% of adults increased risk for complications because of underlying chronic diseases. I was so shocked when I saw the statistics that now 42% of Americans are now considered having BMI of over 30, and that number continues to grow. We in the military are not immune to chronic diseases. This chart was created by the American College of Lifestyle Medicine, showing that 17% of soldiers have hypertension, that we have risk for diabetes, and we spend in the military $1.5 billion treating obesity-related health conditions. Obesity is a growing threat in the U.S. military. The upper charts show the steady rise. Notice the rise, significant rise from 2012 to 2015 here to almost 8%. But the data that was released in 2019 came out of the DoD Health of the Force report show that average obesity in the U.S. military now is 17%. The Navy leads the way at 22%, Air Force 18%, the Army is the DoD average, and the Marine Corps lowest at 8%. Basic training grad gained 4 pounds per year after graduating from basic military training, followed by their increase in abdominal circumference. And after 4 years military service, 37% moved to higher BMI. So why is obesity a risk factor for COVID complications? So it turns out that being obese at BMI greater than 30 does impair our host defense. The first impairment is that it causes our natural killer cell not to function optimally. I tell my patients, natural killer cells are like your special ops. They're constantly monitoring and looking for invasion, antigens of concern, and they just kill on target. And being obese with BMI greater than 30, that those special ops are not functioning appropriately to monitor and protect us. Also decreased cytokine function. We have a decrease in antigen and mitogen stimulation, macrophage and dendritic cell dysfunction, part of your innate immune system. Also alter in our monocyte and lymphocyte dysfunction, leading to a more pro-inflammatory approach, and reduce T cell diversity. We know that people with higher BMI have an increased risk of respiratory infection, and we talked about increased risk for COVID complication. A lot of things in the literature points to the fact that excess visceral fat becomes its own endocrine organ. It's not just the extra fat, but it's an active organ because visceral fat is able to release pro-inflammatory mediators, tumor necrosis factor, interleukin-1, 6, leptin, and others, impact on our T cell population and reduces T cell regulatory and promote more of an inflammatory response. The CDC said that these chronic diseases that we are facing at the nation can be prevented and reversed based on lifestyle. This is a chart that was created by the American College of Lifestyle Medicine. So if we can eat healthier, move more, quit smoking, we can prevent up to 80% of heart disease and stroke, prevent 80% of type 2 diabetes and 40% of cancer. So Another thing about lifestyle and behavior is that it causes immunosenescence, right? Right from the beginning with this pandemic, we hear that people who are at advanced age are at risk. And what is it about advanced age that makes us at risk for COVID? And it's a concept that immune function declines. And we Americans, because of our lifestyle, are actually 5 years older biologically than chronological age. Think about that. So it turns out after midlife, for those who are at midlife, chronological age no longer predicts biological age. So that's a good thing. So there's lots of things we can do to keep our biological age healthy. And if you're interested, there is a biological age calculator. The link is there, profile.covid-age.com. So you can put in basically your lifestyle, what you do, your A1C, cholesterol level, and it'll give you your biological age. So why is it that we're aging 5 years more biologically than chronologically? And I think it has to do with what we eat. Standard American diet, appropriately called SAD. There was an article published by the National Institute of Health, and it concluded nearly entire US population eats a diet that's not on par with recommendation. What's the recommendation? The CDC recommended we eat 3 cups of vegetable and 2 cups of fruits a day, which is not much. A cup is like the size of your fist, so not a huge. If you're bigger, you eat a little more. But only 1 in 10 Americans eat the recommended amount of vegetables and fruits. When I saw that data last year at the start of the pandemic, I was really worried. Like, we're not eating our vegetables and fruits. This is very concerning during a pandemic. And most of us exceed added sugars, saturated fats, and sodium. The USDA did a chart looking at vitamin deficiency in the United States. There's also a widespread macro and micronutrient deficiency. And we know that vitamin A, B vitamin, C, zinc, all these important vitamins and folate play a role in our immune system, immune function. A standard American diet also triggered NLRP3 inflammasome pathway. This was a study done in mice that they fed either a diet of vegetable and fish high in omega-3 and a standard American diet. Turns out a standard American diet leads to oxidized LDL and lipose polysaccharide, which stimulate inflammasome-mediated immunity. It also induced epigenomic, transcriptional, and functional reprogramming of myeloid progenitor cells. So these impact our bone marrow at the cell. The myeloid progenitor cells are the precursor to all the cells, like red blood cell, white blood cell, monocyte, leukocyte, all the cells that we check when we do a CBC. They're very important for immune function. Standard American diet also directly impair GI function, create inflammation in our gut, lead to microbiome imbalance, alter metabolism. Healthy gut bacteria increase our metabolism, and when we eat a high-fat, saturated fat, high-sugar diet, it leads to unhealthy bacteria that tends to conserve fat. Also alter immune function, reduce our T regulatory cell, reduce short-chain fatty acid, which is the source for our energy, cell energy within our large intestine, and it has a role in producing B and K vitamins. I often tell my patient, our GI tract is truly our headquarters for our immune system. So we were facing a terrorist attack, we will protect the Pentagon in our nation. In this case, all that is a virus. We have to protect our gut because 70% of our immune system sits in our GI tract. And in fact, there are more microbiome in our gut than our own cells, microbiome 10 to 1. And then there's over 300 times more bacteria than human gene. Some people like to say that we are not necessarily human. We are bacteria having a human experience because of all much more bacteria genes in our body than our own gene. So modulate it directly. Stress also impacts our microbiome. It alters the composition, function, metabolic activity of our gut microbiome. It alters our digestion, immune response, alter our mood, and how we then respond to stress. So it's almost like a cyclic nature. There's significant interest in the DoD to look at microbiome and in relation to PTSD and pain. The Department of Defense had their initial microbiome research meeting back in 2018, and there's ongoing research looking at diversity of microbiome and function based on stress. Stress also impacts the immune system through the HPA axis, the hypothalamus pituitary adrenal axis. It causes immune dysregulation, lead to anxiety and depression. Prolonged stress leads to elevated IL-6, which increases inflammation throughout our body, and it's been shown to be a risk factor for heart disease, osteoporosis, arthritis, diabetes, and cancer. Prolonged stress has also been shown to shorten telomeres, which lead to immunosenescence. I love reviewing the biology of things. The biology of stress has to do with our sirtuin protein. The sirtuin protein regulate our cells. They're like the CEO of our cell. It regulates cell function, and prolonged stress leads to DNA damage and may impair mitochondrial dysfunction. So we are in a pandemic. We call it COVID, SARS-CoV-2 pandemic. But I think we're also facing co-occurring epidemics. We have been for a long time. Rise in chronic diseases, a population that's overfed and undernourished, not enough vitamins and nutrients in our food, a lot of stress in our daily lives, social isolation, poor sleep, lack of exercise. And also there's the factor of health disparities and other social economic factors. I like to think of the problem we're facing more of a syndemic. And the CDC describes syndemic as two or more epidemics occurring together, interacting synergistically, contributing to higher rate of disease in a population. So I would say not just a pandemic, I think we're in a syndemic. So how do we deal with a syndemic? I think we have to look bigger than just the virus itself. We have to address the root causes of the problem. I really like this tree that's put out by the Institute of Functional Medicine, where the branches and the leaves are symptoms, and we refer them to different specialists. But as a family doc, family physician, like to look at the whole tree. We like to look at the whole person. And what we're finding is when we treat the underlying problems, treat the roots, such as sleep, exercise, nutrition, and stress, we can help patients become more resilient and resolve their problems. In the pain clinic at Walter Reed, I like to use this medical symptom questionnaire for all my new patients to quickly do a review system. What I'm finding is 8 out of 10 chronic pain patients also have some type of GI issue. They also have irritable bowel syndrome or bloating or constipation. And oftentimes, even in chronic pain, you fix the gut, the pain also improves. So the science is really clear that our lifestyle-induced chronic diseases are preventable and reversible. Dr. Dean Ornish, in his book, Undo It, detailed 20 years of study, and he's been able to show that most lifestyle chronic diseases and His research focused on coronary heart disease and early stage prostate cancer can be reversed with lifestyle change. So quick question, quick break. You can type in the chat. In his study, looking at just lifestyle, this is just lifestyle intervention, would include diet, yoga, exercise, maybe some meditation, show that arterial blockages could be reversed in what percentage of participants. So I'll pause a little bit so you can just put it in the chat and I'll tell you the answer. All right, so it turned out 82%. Reversing of arterial blockages, 82% participant. So why aren't we doing more of the lifestyle factor in medicine? Why are we still managing diabetes rather than work toward reversing it? Well, we know for a fact that there's a 17 years gap between evidence and research and clinical practice. That while we are facing a syndemic, we don't have 17 years. We know that nutrition and lifestyle do modulate the immune response, decrease inflammation, healthy gut microbiome, decrease oxidative stress, protect our brain and gut, increase telomere length, which delay biological aging and delay immunosenescence and reverse chronic diseases. And this chart over here is a paper published by Dr. Yanok that show that really underlying inflammation is the root cause of severe complications with COVID. And we should be looking at helping people decrease their underlying inflammation. So our current approach, primary prevention, we have physical distancing, hand washing, vaccinating, wearing a mask with PPE, and secondary prevention is lab testing, and we flatten the curve to help hospitals and ICU be prepared. But yet we're still seeing significant variation in manifestation, hospitalization, and I propose that we have to address the host and human factor to build resilience. So I want to introduce personal protective nutrition, and this is a term coined by Captain Brian Stepanico, a family doc at Fort Bragg. Because we have PPE, we need also PPN. Those are food and nutrients that enhance immune and metabolic resiliency to reverse disease and optimize performance. It's about eating whole food, plant-based, high-quality fiber and protein, anti-inflammatory, antioxidant, microbiome building, and there's some COVID-specific. I like to show my patient this chart right here at the bottom because it shows them what happened to their immune system when they don't eat healthy, and when they do, then their immune system becomes more effective and efficient. And this is a chart that Task Force Resilient members, I know Colonel Marianne Keel is on this, other CHAMP and HPRC representative here at USU help us pull this together. It's a chart that we share with our patients to remind them to focus on the nutrition part, because if our immune system, the headquarter is our gut, our food really helps us build better immune health. Widely studied, we all know this, the Mediterranean diet is highly recommended because it's been shown to help reverse heart disease, also help with immune function. The nurses study show, this is end of 32,000, that sticking with a Mediterranean diet leads to longer telomeres, promote health and longevity. In Australia, they did a study looking at people who eat more fruits and vegetables, have a better sense of curiosity, creativity, and sense of well-being. This is a meta-analysis. Meta-analysis looking at vegetable intake, mainly the flavonoids, and it showed that people who eat more vegetable, higher flavonoids, decrease incidence of upper respiratory tract infection. I like to show this calorie dense graph to my patient when we talk about diet and weight loss, looking at what 500 calories look like. So if you eat mainly vegetable and fruits, it fills up your stomach pretty quickly and you'll get full. another good way to lose weight. We encourage eating whole food plant-based, and shout out for the Human Performance Resource by CHAMP here at USU. Incredible, amazing resources. And looking at a plate, where in a plate, divide in half, that half should be vegetable, and then quarter grain, and then the other quarter is protein. And protein doesn't have to be meat, it could be other legumes. And another graph that I love to show my patient to look what a balanced diet could do for you, because your gut, if it's healthy, is able to produce all the vitamins you need to be more resilient and make your immune system a lot more optimized. And I think it's personal protective lifestyle, that things that we do daily that enhance our immune metabolic resiliency to reverse disease and optimize performance involve sleep, stress management, exercise, connection, time in nature, and having a resilient mindset. Again, another chart that was created by Task Force Resilience member in collaboration with CHAMP to remind people these are the things we should be employing now. There is a widespread sleep deprivation in the United States. CDC estimates that 35% of adults are not getting enough sleep, and even worse in the military. This is a RAND study looking at mean sleep duration. Mean sleep duration in the military active duty members less than 6 hours, and 42% say they're sleeping 5 hours or less. And why is that a concern? Poor sleep. One night poor sleep has been shown to decrease natural killer cell by 70%. So having inadequate sleep makes us all more vulnerable to getting infections. And we've all probably experienced that, right? If you have taken call and didn't sleep well, and we know the next thing we do is we get a cold. So you know that happens clinically. Poor sleep also activate tumor necrosis factor, lipopolysaccharides, and pro-inflammatory genes, as well as increase of pro-inflammatory cytokine IL-6, seeing that again. I often tell my patient, make sure with sleep hygiene, avoid no caffeine after 2 p.m. so they can get to sleep. And sleeping and having a good routine is so important, just to remind everyone, right? Our body produces melatonin naturally, and the pineal gland induces sleep. It needs darkness, and now that everybody's on their iPhones so late, it's hard to fall asleep right afterwards. So limiting news and media 2 hours before. A lot of what we know about melatonin came out of cancer research, and melatonin has been shown to be antioxidant, anti-inflammatory, anti-excitatory, and has immunoregulation effect. It also protects our mitochondria against free radicals. Melatonin, adequate sleep is good for us. Another habit that's good to build in during this time that is stressful for most of us is to do some kind of meditation. Meditation has been shown to decrease inflammatory markers, increase our cell-mediated immunity, and delay biological aging. There's been studies to show that people who meditate and get the flu vaccine have better antibody response. So meditation maybe before managing our stress before we get the COVID vaccine may be helpful. I love this study. This is a study done in Japan, where they took Japanese men who work in Tokyo and took them out to the forest, and they spent 3 days, 2 nights in the forest and measured their natural killer cells. And apparently, spending time in the woods boosts our natural killer cells. And what they show is even after 30 days, that effect's still there. So as the weather gets nicer, time outdoors makes sense. And this is a prescription I like to use with my patient, partner with the park recreation prescription to have people spend more time outdoors. I know here at USU, there's a beautiful wooded area, great for walking, right in front of the medical school. Vitamin D, also very important. Vitamin D acts more like a hormone than a vitamin. According to NHANES data, there's widespread deficiency of vitamin D in the United States. worse in minority groups, people with darker skin color. Vitamin D has been shown for years to have multiple antiviral effects. It modulates both our innate and adaptive immune system. It dampens the excess inflammation. And in people who have vitamin D deficiency, that we have shown to have increased risks of respiratory disease. I read a study out of Spain a couple weeks ago that show 80% of people hospitalized for COVID in Spain have vitamin D deficiency. There was a study that showed that low vitamin D predicts ICU admission and poor survival for COVID. The sun is the best way to get vitamin D. In the winter months, it's harder to do. I aim to get to a goal of 40 to 60. There are food that have natural vitamin D, mushroom and fatty fishes. This is the product that was put together by USU champ here. It's a one-page handout. I really like this handout. I give it out to all my patients to remind them about PPN and PPL. And this is something you can download from the HPRC website. 10 years ago, the chairman, Joint Chief of Staff, the chairman of Joint Chief of Staff had an instruction to put out total force fitness. And I think this is a fantastic model to help us be more resilient. Unfortunately, it hasn't been fully implemented. I think the work has been done. It talks about the 8 domains to keep us resilient. And I think it's time we fully implement total force fitness. Here are some resources. The script on the right I have on my desk, and I always give my patient at least one recommendation, lifestyle recommendation, using the SMART goal that help them move toward better health. Another, I think, underutilized resource in the DoD is Military One Source health coaching. Health coaching is available for free for all active duty, reserve, and family members. And when I make a recommendation on lifestyle change, I know it's hard for my patient, and I often utilize the help of a health coach so that my patient has someone to contact to get more specific instruction, get the how to make these changes. Highly recommend health coaching. Also, another great resource, these are apps that are developed by DoD. It's a script pad that you could order. I also prescribe apps to get people to move toward better health. So in summary, we are seeing one virus with variable manifestation, multiple different vulnerability. So the threat, I believe, is not just a pandemic, but pandemic coexisting with coexisting epidemics. So we're facing a syndemic. Prevent, utilize PPE and PPN and PPL to really improve our readiness, resilience, and performance. And it starts with all of us taking care of ourselves first. Those who are having lunch right now, I hope you have a salad, eating healthy, make sure you stay hydrated. And then protect, how do we protect our patients? How do we minimize inflammation, oxidative stress, and NLRP3 triggers that lead to long-term complications? I think it's about addressing the root causes of diseases and work toward reversing, not just managing chronic diseases. So this presentation is also a call to action. Let's promote total force fitness, nutrition, and lifestyle. I'll take any questions during this time.
Thank you, Dr. Huynh. If anyone has any questions, you can unmute yourself and ask the question or put it in the chat box. I know people have been using the chat function. I think there is a question in there from Lisa saying, anyone have a link or information for ordering the scripts? And if popcorn counts as vegetable.
Just like does ketchup counts as a vegetable?
Valid questions, I would say.
Mylene?
I have a question.
I'll go second in line. Please go first.
Okay. Hi, I'm Jennifer Chang. Hi, Dr. Huynh. It's great to see you. I love the personal protective nutrition, like PPE, PPN, just important as PPE. I'm just wondering, since obviously so much of the lifestyle medicine is behavior based and requires motivation, and it can be overwhelming for patients. And I appreciate the slides with the numerous different resources. I'm just curious, in your own clinic, how you utilize, whether it's frequent follow-up or what do you find effective in helping patients implement change, or what do you find most effective? Thanks.
Thanks, Dr. Chang. Good to see you. For me, luckily, I work with pain patients, and chronic pain is a huge motivator for change. So I link behavior change to better outcome. And also, I like to not take anything away. First thing I do is look at their nutrition status, food intake, and second is sleep. Because those two we all do. We all eat, we all sleep. And that's where we start. So I add vegetable and I add fruit. Can you try just add one vegetable a day or one more fruit a day? And maybe another glass of water. So I find adding things are more effective than trying to take things away. You know, if they like their candy, we say that for later. Another thing that really works is what I'm finding is that our microbiome, when we start to eat healthier, it takes about 3 weeks for it to change. Like all that craving, I think it's a bacteria craving, it's not us, right? When we're healthy, we're not craving these things. And I tell my patient, okay, if you can just do this for 3 weeks, after that, you won't have the craving. And it does work every time. They'll come back and tell me, you're right. After 3 weeks, I don't crave that steak anymore. I don't crave that. And I say, 3 weeks, you deploy for 6 months. 3 weeks is nothing. So giving them a time frame and adding is helpful. And then working on sleep. If people sleep better, they start to feel better and they're able to make changes. Anyone else have anything else to add? I love to learn from what everybody else is doing too.
This is Captain Brian Sipanenko here, family med doc, and extremely supportive here. I'm a member of the Task Force Resilience Group. Just ecstatic about you doing this conversation today. And that question was such an important one, and it was actually going to be one that I was going to echo as well, is what does a conversation look like when you have an opportunity, a patient in front of you that you know they're interested in and they might be motivated? How do you take advantage of that? So I have a 4-part strategy. I just quickly want to mention how I would approach a patient that is willing to do some of this or clearly would benefit from it. One is handouts or memory aids. The patient's not going to remember all the details that you mentioned. You got to have something that you can send them home with, that you've circled 1 or 2 things, and it's a handout or a memory aid. So kudos to those that are asking for some of the resources. Definitely we'll try and make sure you get linked up with the links. The other next part is the one thing. Like, what is the one thing that we're going to focus on that we start with? Because you could be so excited about it and want to circle all 6 things of PPN or PPL. But I usually talk to them and say, let's look at something that you're strong at already. Tell me which one of these do you think you're pretty good at already? And then let's use the items on this as a checklist. And are you hitting all the checklists? We'll start there. When they build some confidence with that one thing, then we'll focus on something that they think they're relatively weak at or need some help with. And then we'll shift focus to the next thing. That kind of leads me to the third part, which is bundles of care. And if I'm putting something that in front of them that's going to be behavior change, I'm not going to send them into the abyss and hope they do well. I'm going to set a telehealth virtual appointment at 1 week, maybe 2 weeks out, and then 2 months out type of thing. Right around the 2 weeks to 4 weeks is where people tend to struggle. And if we need to reorient them or set a different SMART goal, then we can do that right at the 2 weeks to 4 weeks mark. And it can be in person or virtual, whatever they want. But the last thing is, who can help? How do I build their social support or their personal accountability? Who can be that person or group of people? Maybe it's a family member, maybe it's the person down the street. But if it's a family member and the family member is not present, I'll tell them to pull out their phone and call that member, the family member, and I'll I'll have a quick discussion with that family member, say, hey, listen, I have so-and-so in front of me. I'm sending a handout home with them. Please go over it with them. This is what we agreed to do. And that way now you have another person that's holding that person accountable until you see them next time. So thank you. Just wanted to mention that.
Perfect. Thank you, Brian.
Thank you for this lecture. I think it speaks to what a lot of us emphasize during our counseling sessions with our patients. But I often wonder if we know this information, why I haven't seen a stronger emphasis in the DFAC and from basic training to kind of instill these things as almost a preventive measure. So we have them build these habits from 18, 19, 20 years old. So by the time they're 30 and 40, we have already kind of trained their taste buds. We train their body physically, but I haven't seen the same amount of emphasis on training their nutrition and sleep habits and behavioral components.
That's a great point. Yes, earlier the better. Yeah, I know that HPRC and CHAM are doing some work at various bases to make sure there's Go to Green initiatives, to make sure there's more fresh vegetable and fruits available. A lot of military bases are considered food desert because it's really hard to find healthy diet, healthy options. But you made an excellent point. Earlier, the better. Yeah. And I think during the pandemic, I mean, such a great opportunity, but our mindset in medicine is we have a biomedical model of looking at things, right? So now we got a vaccine that's going to save, but there's study to show that people who say have BMI over 30, usually for the flu vaccine, don't respond well to a vaccine, meaning they don't mount an antibody. And I saw there was a study out, I think it was out of Italy, where they look at COVID vaccine and those with chronic diseases or high BMI, and they don't mount an antibody. So the people we want most to protect during this pandemic, the vaccine may not fully protect them. So PPN, PBL, PPE still the key. And Lisa, you made a great point. And I would love to see the day where healthy food options are available throughout all military bases, that we emphasize stress management, sleep, in addition to physical fitness.
Mylene, Brian here. I mean, that brings up the extremely important point of understanding the context of the person sitting in front of you and asking them questions to clarify that context. If they're basic trainees and they eat out of DFAC and they don't have those options, then where can we shift focus to what they do have control over? So maybe it's not the PPN as much. Maybe we spend, a few minutes talking about that, but maybe we shift towards the PPL, stress management, making sure, you get that sleep hygiene down pat, because it's all about the total body burden. And if PPL is under our control, much more so than PPN, then that's where we focus attention. Great question.
Hi, Mylene. Great presentation. Sorry, I joined late, just coming off patient care. I really loved your last slide, that elephant in the room, and that whole concept of a syndemic. When the pandemic really collides with a coexisting epidemic of all these other things, right? So this SARS-CoV really just uncovered the issues that we've been dealing with all along, the obesity, the dysbiosis, all of those things are all rooted in inflammation, gut inflammation. Life and death starts in the gut pretty much. And when you trace it back to the GI tract, it's like, what, 80% of your immune cells lie in the gastrointestinal tract? That's where a lot of the action is at. And that's why people who have those pre-existing conditions are at more risk of severe COVID illnesses, or illnesses. I'm going to use that word, illnesses, as opposed to someone who has a healthy GI tract and healthy immune function. So if that area is compromised, people are going to be at risk. And a lot of things that we talked about, that you talked about today and the subsequent discussion, have major roles in having a very healthy gastrointestinal tract. And I think when we start to have that discussion with people and say, listen, most of the action is really in your gut. And what we're addressing is really having great gut health. It starts with what you put in your mouth, healthy gut bacteria, healthy sleep, exercise. All of those things are going to shift, gut health. And if there's one thing to focus on, and I love what Brian said, if you can pick the one thing to focus on to get the biggest bang for your buck in terms of your overall health, I'll be going for the gut, because it's going to affect brain health. It's going to affect, it's going to affect your mood. It's going to affect your endocrine system, because everything kind of, builds on that. So I really love that concept of the syndemic. And just looking at the different parts of the elephant in the room may not give you the entire picture. And if you're just looking at COVID, you don't see everything else. If you're looking at obesity, you don't necessarily see. And it's not just COVID. COVID was 2019, 2020. We don't know what's coming in 2022. We don't know what's coming in 2025. So we have vaccines right now for COVID, but we don't know what else. I mean, we've seen this before, right? In the previous, different kind of viral issues that we've had in the past. So what's it going to be in the future? The key is how we're going to be prepared. It's not necessarily going to be a vaccine, because by the time you develop a vaccine, so many people would have succumbed already. So we want to be immune resilient, and it starts with the gut. Thank you.
Thank you, Dr. Wumi. That's such a great point. Yes. The elephant in the room is the whole package and our underlying lifestyle nutrition that we really just ignore. I think we tend to medicate chronic diseases and not work toward reversing them. And the science is so clear. Why aren't we reversing these chronic diseases?
Mylene, Brian here. I just want to share some info that I got from the ground level. A peer of mine who's in the course with me right now says his brigade, it's AirCav group, his brigade of the soldiers that were allowed to opt in for the vaccine, that were able to voluntarily turn down the vaccine rate for their entire brigade was only 20%. And if we're talking about speaking from a biomedical perspective and that the vaccine will save lives, if the acceptance rate for the seemingly healthy population, which is our active duty population, which may be a false concept. I mean, with some of the stats that you were talking about of the disease rates and the nutrient deficiencies in the military population and the sleep issues in the military population, we have less than 50% are going to be opting in for the vaccine. That's just a guess. That's my own guess. But 20% was a concerning number when I heard it. Over.
And if I might just say something about military vaccines in general, and this is speaking from the VA, from being in the VA and having seen, folks who deployed to the first Gulf when they came back. There's a lot of distrust with regards to vaccines, especially when initially vaccines were mandated, right? The anthrax, the whole debacle with the anthrax vaccines, and then they were no longer mandated. People haven't forgotten that. And so when we start to think about mass vaccinations, and then there's a question as to whether or not at some point these vaccines would be mandated, people are cautious, and rightfully so. And so I think as a healthcare community, we need to think about these things. What have we done in the past with regards to vaccines that are going to make people worry about what would happen to them when there are a number of unknowns? We do have studies. The information that we have is relatively limited at this point, and we don't have long-term studies at this point. So I can understand why the acceptance rate would be relatively low if people are given the option.
And perhaps this is where this information and this presentation specifically is empowering. It's empowering for us and for the soldier population that we're able to shift the conversation to, well, okay, I mean, it sounds like you want to protect yourself, and here's ways that we can do that, and here's things under your control. So PPN, PPL can definitely help address that gap.
That's right. And even PPN and PPL will help you if you choose to get the vaccine for your body to mount an appropriate immune response, right? So getting enough sleep, healthy eating, all that really play a role in vaccine interaction too. So how we are taking care of ourselves really determine how well our body actually responds to the vaccine and mount the appropriate antibody to protect us. So back to the basics. I mean, especially in family medicine, right? Just seeing the whole person and back to every chronic diseases, if you look at the clinical practice guideline, starts with lifestyle change. But yet we are, for many reasons, a lot of it's time factor, we've not emphasized that as much as we should. Other comments or questions?
Well, if there are not any more questions, I would like to thank Dr. Huynh for the great presentation and for everyone who participated in the great discussion afterwards. Thank you so much. I have a couple of announcements, so please complete evaluation for today's presentation to give feedback to us as well as Dr. Huynh. That link, I put it in the email that I sent out for ground rounds. Also, for the next ground rounds coming up in April, we're talking about telehealth. Dr. Mandy Kuda is going to speak to us, and she would like us to do some needs assessment. So I will put the link in the chat box right now. So if you can please complete that, I would greatly appreciate. I'll stay on for a few more minutes. Thank you everyone for joining us, and we'll see you next month. Our next ground rounds is going to be April 14th. Look out for email with that from me. Thank you, Dr. Huynh, and everyone for participating.
Bye-bye. Good to see everybody. Everybody stay healthy. Remember your PPN and PPL.